The following was recorded in front of a live studio audience at the Studio 21 Podcast Café. This is the United Podcast Network.
Welcome to the Friends in Recovery podcast, the podcast that is here to help you, a loved one, or a friend get started down the road to recovery. This is the Friends in Recovery podcast, brought to you by the Genesis House. Genesis House, providing a safe, nurturing environment to heal from addiction since 1992. Please be a friend and share our message with a friend on Podbean, iTunes, iHeartRadio, or YouTube. And now, here are your Friends in Recovery.
Hey, welcome to Friends in Recovery podcast. I am the I am the podfather, Mike Miles, my good friend Jersey Ed.
Hi, everybody.
And we have Ed, extraordinaire producer.
Good afternoon, gentlemen.
I think Mike had too much coffee today.
Yeah,
what's going on over there?
And we're podcasting live from Studio 21 Podcast Cafe up in beautiful, sunny, 64-degree Salem, New Hampshire. Ed, it's nice to be here.
Yeah, it is, Mike. Long time no see.
Ed was tickling me when we started this off here.
I know. And last week you were on your own.
That's right.
Last show.
We have a very, very astute guest today, Ed.
We do.
But before we introduce him, do we have some business?
We do, and I don't have the paperwork in front of me.
You don't?
So,
okay, well, first of all, we want to thank Genesis for all they do for us.
Absolutely. Oh, here it is.
Genesis House.
Now I get the paperwork in front of me.
You think you would have memorized it by now, Ed?
I know. Well, we just want to thank Genesis House for setting up this beautiful studio, as Mike calls it in the beginning, and that we can spread the great message to everyone out there. If you enjoy Friends in Recovery podcast, join us for Friends in Recovery community supported events. We hold monthly gatherings in Florida and New Jersey. Massachusetts is coming soon, and Bob is going to be...
Bob Cox.
Bob Cox is going to be doing that, and we'll have him on the show to talk about it. Yep.
Yes.
So we'll have a Friends in Recovery community up here too.
He's an alumni.
Yeah. That's our.
He's an alumnus.
That's our alumni, Genesis House alumni. So,
correct.
We also have a special event coming up. Friends in Recovery will be participating in Atlantic City Marathon in October. So you come and kind of talk to us or support us or whatever. And I believe you're going to be. Going, if I'm not mistaken.
Most definitely.
Yep. And here's the important part. Follow us on Facebook for updates and subscribe on YouTube and all your podcast catchers. And, of course, we're always looking for guest speakers and people to tell about the recovery stories, professionals, just like the gentleman we're going to have on today.
Correct.
And, just reach out to either Melissa or Skylar. It'll be all in the show notes as usual.
Sounds good.
Or you can email us at help@friendsinrecoverypodcast.com. And I try to get back to everybody, all the emails that do come in. I try to answer them, and that's it.
That's it.
Back to you in the newsroom, Mike.
So our astute guest today is the Dr. Stephen R. as in R. Van Schoyck. And Dr. Van Schoyck is a clinical psychologist with over 34 years' experience in private practice. He received his bachelor's degree in biology from Princeton University. That's very impressive. And then he was admitted into a 7-year postgraduate program to receive his PhD from the University of Cincinnati. Also known as Dr. Steve, he has managed and directed centers for treatment of medically significant obesity. He founded his own company and established 5 hospital-based nutrition and weight management clinics with over 40 employees under his supervision. Wow, that's amazing. Dr. Steve is also a husband of 45 years. He has 4 adult children, 1 son, 3 daughters, 6 grandchildren, 2 boys and 4 girls, and he resides in Newtown, PA. And Ed, I'm going to shoot it back to you. And
Doc, welcome. Thanks for coming on the show.
Hey, great. Thanks for having me.
Yep. Newtown is in my backyard, so you're a neighbor of mine.
Oh, where are you?
I'm in Langhorne.
Oh, actually, that's where I live. My practice is in Newtown.
Okay.
So we're neighbors.
Okay, so we're neighbors. You might even be my next door neighbor. I'm always working, so I don't know anybody in my neighborhood. So,
there's one very important fact I left out, and it just came to my attention. Dr. Steve is also an author, and his latest book, It's in paperback. It's called Looking for Yourself in All the Wrong Places. And when was that published? 2001, Doctor?
No, that's 2019. It was just published a couple months ago.
Wow.
Brand new.
Brand new
Looking
book.
for Yourself in All the Wrong Places. Awesome.
That sounds like almost everybody in recovery at some point in time.
Just published.
Yeah, that's why it's a relevant topic.
Yeah,
I looked
absolutely.
this up today. I'm going to go right on and check this out.
Absolutely. So tell us a little bit about the book. Maybe tell us a little bit about your practice, and just give us a little rundown.
Okay. My practice, I treat kind of the whole gamut of human kind of psychological problems. So I have a significant number of people that have been addicts, whether it be abusing cocaine, alcohol, opioids. So I'm familiar with that struggle. I don't specialize in that per se, but I deal with a lot of people with anxiety and depression, and I believe strongly that that's a precursor to the use of substances.
Oh, yeah.
So I've been in practice 34 years now, and I counted up, I've probably been over 60,000 hours of direct patient care.
Wow.
And really wanted to take what I had seen and try to give it to the world in a sense, and that's what made me write that book. So the book is a book about learning how to read your emotions and to kind of tell the difference between who you are and how you were raised, and understand the emotional conflicts that kind of go on as the source of a lot of anxiety and depression that people have to deal with. I think we misunderstand anxiety and depression, and it leads people to pursue the wrong treatment. Anxiety and depression are treated as medical conditions by a lot of folks, and that's the wrong way to look at it. All of us come from imperfect families, so all of us, in a sense, are raised imperfectly.
Yep.
Those imperfections cause us to have to hide our emotions, and we end up becoming anxious when we go to feel things that we're not allowed to feel. So that's the major source of anxiety that exists in all human beings. Some people have true medical conditions. They have, mental illness in a sense. All of us, though, suffer from the psychological variety. But the problem is people don't treat it that way. They treat it as a medical condition needing medication. And that becomes very confusing then, even for the person who uses substances, because it's seen as very normal to try to medicate away your emotions.
Well, that's the thing, and I know I still get anxiety now. Mike is very open about his anxiety, and we're both in recovery, Doc, a pretty long time, and I've noticed myself, my anxiety is building more and more as I get more and more down the road in my recovery, and as you too, Mike, you talk about it on there
Right.
all the time. But is that kind of the medication part you're talking about? Is that what we did to heal ourselves, or at least think to heal ourselves? Because I always hear people using pot for to medicate themselves, but or some kind of benzos or something to make them feel better, take the edge off, I guess.
Yeah, but I think that's, again, taking them down the wrong. You're treating the symptom. The cause is that if your anxiety is increasing, what you need to look at is it's a function of your relationships being distressed. And you need to start to examine kind of the pressures that are coming at you from the different relationships you have, right. Whether it be your family, your wife, your boss, your friends. As those relationships change, shift, or break down, and you have to represent yourself more strongly, that's the real basis for why we feel anxious.
Well, that's a very good point. I suffered from severe anxiety my second year of sobriety, actually going into my third year of sobriety. So much so that I went to see a psychiatrist in Boston, St. Elizabeth's. I met this Dr. Henry Abraham, wonderful man. He put me on a medication called dizipramine. It was like a blocker, I believe.
Okay.
And I had just got sober from alcohol and drugs. I didn't really want to take any medication, but he convinced me to take this. And it was about an 18-month period where I went from 10 milligrams, 20, 40, 60, 60, 40, 20, and off. And I got to say, the anxiety, what you said just makes so much sense, because my anxiety that I thought was just coming out of nowhere was situational. It had a lot to do with me living life on life's terms without, coke, booze, weed, Quaaludes, or whatever. Anything I could pop in my mouth that would make me feel a little bit better. And yeah, it's very interesting. I have a quick question for you, not to get off the topic, but the book on
Sure.
obesity. The book on obesity. Now, I've had a couple of clients, young ladies, that have had eating disorders, and I know it's not obesity. It was just the opposite. They were basically, I don't want to say they were anorexic. I am not a doctor, but I just felt like it was way over my head, so I referred them to somebody. I wanted them to get the proper help. So in all your studies and all your knowledge and experience with people with their weight, do you look at food as an addiction?
No, not at all. Matter of fact, I think that's the wrong way to understand it.
Could you talk on that just a bit?
Yeah, sure.
Thank you.
The difference is food is a naturally occurring need. It's a response from the body, just like sex is. So to use addiction as a model for either sex or food ignores the fact that the impulses are normal and natural. Wow. It's better to think of it as obsession. Mm-hmm. That what it is it's a sign of severe anxiety about something. So the anorexic, for example, is trying to be perfect to please people, right? It's not a food problem. It's a people problem. The same thing is true with obesity, except with obesity, there is true metabolic differences among people. We're not all designed to be the same size and shape. Mm-hmm. And when people try to fight their own biology at a level that they can't fight, they're just going to weight cycle all the time. That's not an addiction. That's basically a misunderstanding of the problem. Okay. So you have to look at the anxiety that exists a lot of times in eating, especially with people who have failed at managing their weight and then been blamed for it.
Right.
So there's a tremendous amount of shame that's associated with, obesity.
So it seems like that the anxiety, like you said, is all built into us, and it's then it's created even more havoc on us, depending on our job or our situation, our life situation, and then we can try to, I guess, either fix it with a doctor like you, or eat, do drugs, drink, probably withdraw from life too. If I don't talk to you, if I don't talk to anybody, my anxiety would probably go away. Is that kind of how, without being a doctor, is that kind of how we would probably handle it? And we come see you, obviously, when it gets too much.
Think of it this way: anxiety has to be managed by the mind. And so what the mind does is it creates defenses to handle it. So we obsess, essentially. Some people will obsess in response to fear. So that obsession can turn to anything from being afraid of germs on a doorknob, to being obsessed about your body size. Mm-hmm. We can also distract ourselves as a defense, where we turn to substances to try to medicate away our emotions. But there's some response that the mind has to fear that basically drives our defensive reactions. So part of what we need to do in understanding ourselves is understand how to read our own defenses to, in a sense, search for our real emotions. Because our emotions are beyond the anxiety. That's like a signal that the deeper emotions are getting stirred. You got to learn to know yourself to know how to find those deeper emotions, to know what to do with them.
And then once those signals hit, then there's different trigger points that you can stop to make them go any further than what they're doing. I'm guessing is that how it's.
Well, you can manage your emotions. A lot of people think you're supposed to push your emotions away. You're supposed to use them.
Yeah.
They're information. They are telling you something about the state of your relationship.
Yeah.
Like if you're angry, you're angry for a reason. You're angry because there's some imbalance kind of somewhere that needs to be restored.
Okay.
In some kind of relationship.
Sure.
So, but a lot of people are trained not to feel anger.
Especially
you're
men.
not allowed to be angry at your mom and dad, for example.
Yeah. Yeah.
How to quality?
So when people feel, start to experience anger, they often experience it as anxiety.
Okay. And
so they get horribly confused about what to do, and so they turn to all the the mechanisms to kind of manage the fear, and then the anger never gets surfaced, and the problem behind it never gets defined.
Doctor, let me ask you a question. I have a practice myself, and I do a lot of counseling, mostly on substance use and abuse, but I'm a clinical social worker. Do you equate anger and an angry response or a pleasant response? Do they come from the same part of the brain or the same emotional
Sure, the amygdala runs, all our emotional responses.
Okay. Anger is a natural response. I mean, we're supposed to have some type of anger, correct?
Well, if you don't know when to protect yourself because anger
Bingo.
tells you there's a problem. So it
Bingo.
means it's time to like react and,
Right.
and to do something. People confuse anger and rage though.
Right.
Okay.
Right. Like, and so they think they're angry when they're like calling somebody a name or attacking their character. Those are rageful responses.
Right.
Well, what's an anger?
Anger is a lower level response where you're saying, hey, something's wrong here. Can we figure it out? Can we work it out so there's like a win-win situation between us?
So kind of getting frustrated or uneasy about a situation or something like that would be more of an anger, you're saying?
Yeah. Well, we have lots of names for anger,
Okay.
right? That create the whole gamut of everything from, frustrated to pissed off to like being in a rage.
Okay.
The idea is to learn how to recognize it at its lowest level so you can work with it before it turns into rage. When you package your anger, your natural anger, it comes out as rage.
Okay.
Doctor, we're going to take a quick break. We're going to leave it here at anger and rage. This is very, very informative and good stuff. We appreciate it.
Talk to you after the break.
We'll be back after the break. Friends of
good.
Recovery Podcast.
Genesis House is a premier substance abuse and rehabilitation facility located in beautiful Palm Beach County, Florida. We have been providing the highest quality of addiction treatment since 1992 and are accredited by the Joint Commission. We offer a range of programs that include detox, residential treatment, dual diagnosis, a Christian track for people who want to incorporate their faith into treatment, a uniform services track, and we work with most major insurance carriers. Genesis House is led by a dedicated team of administrative and clinical professionals, and we stand on our commitment to excellence in recovery services. Contact us today to find out more about our program. Take the first step and call Genesis House at 800-737-0933 or visit us on the web at www.genesishouse.net. That's 800-737-0933 or www.genesishouse.net. Begin your journey to a long and successful recovery with Genesis House.
Hey, welcome back, Friends of Recovery Podcast.
.com.
I am the Podfather, Mike Miles, my good friend Jersey Ed.
Hello.
Chionchio, and if you can spell that,
You win the prize.
you win the prize, and the prize will be a mug or a T-shirt.
That's right. We still got those mugs. And
We got to get rid of them.
Email us, guys, at help@friendsofrecoverypodcast.com, and we'll send you a shirt or a mug. And Doc, I'll bring you a mug and a shirt home, and I'll drop it off at your office sometime next week.
Okay, I'll drop it off at my house.
Okay, yeah, you're my neighbor, so
You don't want this guy at your house, Doc. Trust me.
Hey, based on what he said, I don't even know if he'd be my neighbor.
I know, right? That's right.
He basically told you stay away. That's what he said.
What was that movie where the patients are following the doctor around?
What about Bob?
What about Bob? Yeah.
Great movie. Bill
That'll
Murray.
be
My
me and-
kid's
be me
worst
and you.
nightmare. and to tell you the truth, I've never been on a vacation where I haven't run into a patient.
I'm sure.
That's even worse, right?
Good God.
That's good stuff. Hey, Doc, this has been a great, so far, a great podcast. Can we talk about your book a little bit? You have a few of them here. I'm going to grab Looking for Yourself in All the Wrong Places, published in 2019. How long did it take you to write it? What's it chock full of? And go ahead.
It took me about 18 years to write it. It's a collection of all the experiences I've had as a therapist, over 60,000 hours of direct patient care. And there are patterns that I noticed occurring all the time within the patients I talk to. And I felt that if I could condense and help people understand what goes on with their emotions, how their mind works with emotions, how their self is formed, what creates anxiety and depression, that it would help my patients truly understand how to benefit from treatment. So the book is written to really, help people that are thinking about treatment begin to understand how it could help them, and also people in treatment to kind of crystallize what their experience is.
Now, everything we spoke about before the break, all that, the anxiety and everything, that's obviously in the book too, I'm guessing.
Oh, yeah.
Okay.
So if you look at the title and talk about, how come we can't find ourselves or even know our authentic self, that has a lot to do with how we manage emotions. Because your self is defined by the emotions that you follow. So we have two different sets of emotions and two different sources of emotions in the mind. One is the messages from the way we're raised, gives us messages that are encoded with fear, guilt, and shame.
Yep.
But you also have naturally occurring reactions that are driven more by more basic emotions like joy and sadness and anger. That those are the emotions you want to be the driver of your choices. But we are so programmed by our life experiences, within our families, that we hide a lot of times our natural emotions and are driven by the learned emotions. And when that happens, we're not living our own lives. We're living a life that's dictated by the way we were raised. We're living our parents' lives, basically. To be true to yourself, you have to uncover those natural emotions so that they can be the basis for your own life choices.
And that's so true, Doc. I was just talking to Mike during the break. I had this anxiety attack today on the way to work, and it just drove me nuts. I very rarely get them, but for some reason I really had a really bad anxiety attack, and it was about, like, I thought I was not gonna die, but I thought I had something wrong with me, and my mother.
Yeah, it can be powerful.
Oh my God! I was probably gonna. I thought I was gonna go to the hospital. But of course, being in the program, I called a couple people, and I got out of myself. A friend of mine said, "Stay out of your head. It's a dangerous neighborhood," and which is true.
There's a crazy doctor living in it.
Yeah, exactly. Oh yeah. I was writing my will out, or handing my will out. So, but the point I was going to make is that, I remember my mom doing that. I remember my sister has anxiety. My kids have anxiety, and everything you're saying, it's kind of pushed by life and not by joy or happiness or sadness, and it's so true,
Right. It's pushed by fear and a lot of suppressed emotion.
Yeah.
I learned a lot about this, Mike, when I was in college. I ended up having panic attacks so severely that I had to drop out of Princeton in my junior year.
Oh,
and that was what kind of put me on the path to trying to figure out, what went on and what does it mean and how to make sense of it. And, I spent my lifetime kind of devoted to that. And I have a whole chapter that kind of discusses my life and what I learned about having to deal with my own emotions. A lot of my patients really enjoy, reading that because I become human, not just the doctor.
Right.
And they respect the fact that I was that willing to kind of share my story.
Certainly.
Yeah.
It's a little embarrassing to put it out there. As a human, I've walked through Newtown and had people make calls, cat calls to me. But that's part of what you got to live with when you come clean.
Listen, when you're sharing your personal strengths and your weaknesses, it helps others too. And knowing, just hearing this from me anyways, and hopefully anybody out there listening. Well, I think we have people listening, don't we?
I hope so. I'm listening.
That's going to kind of maybe prompt them to understand that, it's not me. It's
right.
This is this other stuff that's going on, and hopefully seeking help if you're in the Bucks County area through the doc or whatever.
Right.
It's definitely something that can be fixed. Is that correct?
Oh, it's not only fixable. If you learn how to read your emotions, then you start operating in a way that makes you feel stronger.
Okay.
If you don't understand them, they run you, and you feel
Certainly.
weaker.
That's a good point, Doc. Earlier, when we first started the podcast, you had mentioned. We were talking about eating disorder, and you said trying to please others. So let me just ask you about people pleasing. A person who's a people pleaser, someone who wants to please people, doesn't want to hurt their feelings, will actually go out of their way to do something they don't want to do just to please that one person who could be totally insignificant. It could be the grocery guy. You know what I'm saying?
Could be the waiter.
Could be any. Exactly.
Send your food back.
Talk about that a little, will you, please?
Sure. In fact, we're all people pleasers because we're born dependent on our parents. So we have to please them to survive. And that's the basis for the way we forge our first sense of who we are. So by pleasing our moms and dads, we get them to praise us and love us. But that's not really who we are. We have to learn how to grow that other set of reactions. where we know sometimes when we're told to do something that just doesn't feel right to us. That's when you start engaging your own natural self.
Right.
And that is a very difficult journey to learn how to listen to that voice. And you can't just call it like gut instinct, because our gut is poisoned by our family experience. You have to be able to separate the emotions in your gut to know which ones to listen to and which ones to follow. If you don't know that, you will automatically be a people pleaser, because that's how all of us survive.
So for some of us, it's hard to say no to almost to anything, and that's how we were brought up. But you're saying the natural thing to do is to kind of listen to the situation, and if we do need to help them or figure out what to do with them, then we do. If not, then we just go out our own business, and that's it. We don't have to, whatever the people pleasing thing is at the time. Then
people pleasing is safe, and it reduces anxiety.
Also, it reduces
that's
conflict.
Why people do it.
It reduces conflict.
Right. But it's the cost is you're having to suppress your own real self. And as you get older, you have to basically let that self emerge, or you live a life driven by others and you don't feel like you even know who you are.
Yep, exactly. We have only a couple more minutes here, Doc. I just want to make sure that we get everything in about you. We talked about anxiety. We talked about substance abuse, and a little bit of everything. Tell us a little bit about your practice. How can somebody get a hold of you? Because if somebody's listening and they want to kind of get help, can you tell us how we can do that?
Sure. All the information about me is on my website. You can go to www.drvanschoyck.com. That's DrVanschoyck.com. And they can learn all about my background, where my practice is, those kind of things. You can also purchase the book on Amazon.com, and I'd encourage all your listeners to do that. It contains a lot of information, gleaned from thousands of patients over many hours, that I think is very representative of all people.
Yeah.
And if you're listening, Looking for Yourself in All the Wrong Places is the name of the book.
Yeah, it's a wonderful book. Me and Mike, we got in the mail, but we didn't get a chance to read it. We did order it. We didn't get a chance to read it. It just came I'll
be reading it tonight, I'll tell you that.
Yeah. And, it's just been a pleasure having you on here, Doc, and hopefully I'll see you when I get home later.
Sounds good. I look forward to it.
Absolutely.
We'll have coffee up at the coffee house.
Yes, absolutely. Up in Langhorne. We will do that, absolutely. So thanks for being
Dr. Steve, you're the best.
Yeah, thanks, Dr. Steve. One real quick thing,
Ed.
Mike. Thanks, Doc. One real thing real quick, Mike. I want to let our listeners know, for our first responders, and this is perfect. This subject is perfect thing to talk about.
Spit it out.
It's this damn coffee that got me going. My words are going out too fast. So we started a new podcast.
Right. We did last night.
Yep, and we did, and it was excellent.
Friends in Recovery. Answering the Call. Correct.
First Responders Podcast. Right. It's a little different setting than what you're going to see here, but we're going to keep the same basic information, but we're going to focus it on first responders only.
More on behavior than substance abuse.
Everything.
Right.
Yeah, you name it, behavioral health, whatever it is. So just look for us. It'll be in the email if you guys can subscribe to or email us. And
Friends in Recovery Podcast.com.
Answering the Call. That's the new podcast. So
see you next week.
Stay sober, everybody.
The views and opinions expressed by the hosts, guests, or callers of this program do not necessarily reflect the opinions of the Studio 21 Podcast Café, the United Podcast Network, its partners, or affiliates.